Hey y'all, happy Sunday. Welcome back to my channel. Today I am going to be talking a little bit more about my last appointment and all of the testing that I have to do. I haven't even looked over the papers. Stop growling. This is our newest member. You're gonna hear them fight the whole time because she's feisty. But anyways, so I haven't really had a chance to look over the testing besides my last video, what I did in the car. Because after that, it was like Christmas Eve, Christmas, New Year's Eve, New Year's. And we had some changes in the office. So we've been busy. So it's just been crazy. This is literally my first day, like sitting down and being able to actually do something. I always have to keep an ear out because you never know what they're getting into. Anyways, so this, like I said, it's my first time going through it. I figured I would record it with you guys and go over everything that the requirements are. This is kind of like a dog ate my homework situation. So I had this in my backseat, and then Ryan loaded Duke up because he goes everywhere with us, and he demolished his paper. So I am going to, it has like footprints and everything. I'm just gonna make copies of it. That way I have fresh copies and put it in a new folder. But anyways, so like I said, it's my first time going through it, so God only knows what's in here. Holy crap, this is like a friggin' 3-ring binder. There's so much stuff. Hey, keep it down. No biting, Baylor. I want kids. Anyways, so I think after like looking over this, it's not the testing that's stressful, it's how it's done. So when I was at my appointment, they were saying you have to call the first day of your menstrual cycle, and then the second day make an appointment, and you have to have labs drawn at 8, at 10, at 12, at 2, at 4. There's like a bunch of different things, and I think that's the most stressful part for me is like, how am I gonna remember all these times and when I can do it? But luckily I work for a medical office, so I am able to do it at my office. So I don't have to drive to Brandon for this, thank God. So anyways, so the first page of the testing that they want done is I have to do a 2-hour glucose test. I have to do a total women's test, whatever that is. I don't really know. A VAB, I don't really know. I work in a freaking medical office. Immune deficiency, so I could see that. My hemoglobin, I have to do HCV, CBC test, which I figured. Let's see, ANA test. I have to do a sulfate test, TH, ABO grouping, my prolactin test. So that is for the labs that I have to do. And she told me 10,000 times all of the instructions of when to do them. Could not really tell you. It was all just a freaking blur at that appointment. Next is going to be an HSG ultrasound where they inject dye into my ovaries, and then they go in and look to see if my tubes are open, to see if that could be the reason why I am not getting pregnant and cannot conceive. So just a little example there. I don't know if you guys can see. I can't see. Oh, look at my face. So there is kind of like a demonstration of what they do to see if the tubes are open or not. They told me to read over this entire thing just to go through it. So it says, what is the next step if my tubes are blocked? And the answer is, if your tubes are blocked, your doctor will likely recommend either a surgical procedure to directly view the tubes or bypass the tubes and perform IVF. So at least they give you kind of answers of what to expect if there is any issues. It says here, schedule your HSG. An HSG test is performed between days 6 to 12 of the menstrual cycle. Please contact the office. You are normally seen when your cycle begins. For your safety, if you are allergic to shellfish or iodine or have had any prior reaction to x-ray dye, it is preferable that your procedure be scheduled at a hospital, which I'm not, so hopefully I'll just be able to do it in office. It's in Tampa, the office that they do it in. So you have to give a 48-hour notice of scheduling an appointment, which you should be able to if they want days 6 to 12 of your cycle. Preparing for your procedure, please remember to take the medications that your doctor's office prescribes to prepare you for this procedure. An antibiotic often used to prevent potential infections will help any pain you may experience after the procedure. Let's see here. We will have to get a urine sample to rule out pregnancy. which is good. Don't have any worries there. And then what to expect after your procedure. After your procedure, you may experience cramping for several minutes. Great, as if I haven't already had that for the last 3 months. Since my exam at that office, for like the next 3 or 4 days, I had intense pain in my ovaries, and then now my cycle is supposed to begin soon, so I've been cramping very bad. Sometimes there is a mild bleeding or spotting after a test. If you have bleeding that is heavier than a menstrual cycle or a temperature above 100, please call the office for an evaluation. So that is the ultrasound that I have to do. And so this is the paper that kind of like goes over everything and the instructions of what I have to do. All of the labs on the days that I have to go, what day it needs to be done, at what time it needs to be done, I should say. And then also they want me to track my ovulation, and they gave me the kit that I need to buy to do it. It's Clear Blue Easy is what they recommend. So I have to have a PCOS lab, fasting at 8 a.m. in the morning for that one. And then it says day 2, 3, and 4 of your menstrual period, you have to have an E2, FSH, and an LH test. They want a follicle count sonogram on day 2, 3, or 4. Additional blood work, AMH, TSH, DHEA. This means probably nothing to you guys, but if you Google it, I'm sure you can get answers. Genetic testing, PRL, free T4, new infertility panel, total testosterone, CMP panel, HGB. Anything else I'm missing? No, I think I got it all. The ultrasound that I have to do, the dye testing, and then also Ryan has to do testing as well for sperm count. So with that, it was kind of like odd. You can either go into the office and do your thing, or you can do it at home, but it has to be at the office within an hour, which we only live like 30 to 45 minutes away. So we'll probably take that route because I just can't see the office thing happening, honestly. So that really is what I have to do all together. Like I said, it doesn't seem like a whole lot to me, but it's just at the times you have to do it. So you have to keep track of your day 2, your day 3, your day 4, how many hours it's been, you know, things like that. And it's a lot of different things that have to be done at different times. So you really just have to stay on top of it. So just a little fun fact, at my appointment when I had that test, before I had it done, during me having it done, and at checkout, they told me, you know, this is what you'll have to do. We will not contact you unless your test comes back with STDs. 3 times is what they told me. They said that. We will not contact you. You'll call us when you start your menstrual cycle. Okay, no problem. Sitting at work, my phone rings. Baylor, enough. I'm sitting at work and my phone rings and I answer. Stop barking at him. And I answer and she's like, hi, this is the reproductive medicine group. And I'm like, hi, freaking out because that's what they told me. She's like, I just wanted to follow up to see if you had any questions on when to do anything or anything like that. And I was like, no, but if you could refer me to cardiology because you just gave me a heart attack. Based on what you said in the office, you wouldn't be contacting me unless I had STDs. So that was definitely a scare because I was like, I know I'm clean. I know Ryan's clean. What the hell is going on? So besides that, that really sums it up. Over the next 2 months or so, I'm going to be doing all of these tests. I am hoping to start my cycle soon. I've been cramping. My app says that I am 3 days late. Yeah, today's Sunday. So 3 days late, which is nothing out of the ordinary for me because sometimes it's, like I said, it's a hit or miss. So I'm gonna do all of my testing first and then Ryan will go in and do his testing. As far as the labs go, some of them are not covered by insurance, so they bill them out to a third-party company. So it's like $200 for a lab or $300 for a lab to get those results for blood work, which isn't bad. I expected it to be more. So Baylor, stop biting him. Like, subscribe, turn on post notifications.